Can any of you guess what, in the first 15 presidential primary debates of 2016, which words were used most? You know they do that sort of system where they can, whatever it's called, wordify. What words do you think were used most? Tremendous. I wonder where that came from. Another one was speculation, which came from the left. And the third was apocalyptic. So, again, whoever does this is beyond me, but what percentage of the 500,000 utterances do you think involved the words data, research, or evidence? I actually know this. 0.006%. So I just put that out there to surface a sort of fundamental concern that given the enormous amount of money that is invested in schooling in particular, that our political discourse certainly, and often our personal discourse, is not actually rooted around what matters and what works. And we don't know, there's an enormous amount of innovation that's going on, but we don't have a lot of evidence about which innovations actually work. And so I'm hopeful that today we're going to talk briefly with the panel about these questions and why this matters. And that's the question I'm going to start with. I'm going to start first, though, by introducing my panel very quickly. Mr. Barron from the Arnold Foundation, Greg Johnson from The Bottom Line. The Bottom Line is a nonprofit that gets kids to and through college and has done some very rigorous analysis of itself, to its credit. And Liz Dozier from Chicago Beyond. Chicago Beyond is a new philanthropic entity on our horizon dedicated to improving educational outcomes for young people and reducing youth violence in the city of Chicago. So with that, I'm going to just ask a general question to all of you, or any of you who want to answer it, and that is, what is the problem? Like, what is the data problem? Why are we having this conversation?
I'll take it? I'll give the definitive answer, and then the others can chime in.
It's going to be contentious.
The problem is, I'd suggest, is that when rigorous evaluations are done to evaluate what works in education and other areas, they find that many widely held beliefs about what is effective, what is not effective, are not accurate. So, and that's true not just in education, it's true in other fields. So for example, a fellow named Jim Manzi published a book a couple of years ago reporting that Google and Microsoft have conducted 13,000 rigorous evaluations, randomized controlled trials of different business strategies over the past few years. 80 to 90% of the strategies being tested were found in these studies to have no significant effect. In Manzi's words, innovative ideas rarely work. In medicine, the same thing is true. Even when you have promising evidence in initial clinical studies, when the more definitive evaluation is done, the big randomized trial done in phase 3 to determine whether the drug can go on the market, in more than half of the cases, the promising early evidence is not confirmed when the more definitive study is done. It's overturned. Same thing is true in education. So the Department of Education, U.S. Department of Education's research arm in 2002 started funding a lot of big, rigorous evaluations for the first time ever in education. Everything from school choice programs to teacher training programs, different curricula. And it turns out that, unfortunately, of the 90 different interventions that were evaluated, between 80 and 90% of those were found not to produce meaningful effects compared to what schools were doing already in the control group. Now, there are some examples of things that work, but I think what the history of evaluations in general teaches us is the need for humility in our beliefs about what works and the fundamental importance of rigorous testing to find the subset of things that really do produce meaningful impacts so that they can be scaled up. Otherwise, it's hard to see how you make progress in education.
that was the definitive answer. Greg?
I will chime in by saying that they're hard to understand. I remember back in 2004, I was working with a friend of the program who was a grad student at the time and had recently finished his work with us, and he really knew a lot about our program, and we were always unable to take as many students into the door that we were able to serve because we had just a long waiting list. And he said, you know, your program would be a really good opportunity for a random control trial. And I was like, what? Had no idea what he was talking about. That was, you know, a decade plus ago, and had I taken up his advice then, we would be done with our RCT and we would have the full boat results. But I just didn't know enough, and as a practitioner, you know, it scares a lot of people away. So why don't people jump in? I don't think we as a group educate ourselves on exactly what it is, how to do it. I don't know that the resources there are present and available for most of us as practitioners to really jump in. So I think that complicates this, is you're worried about the results, you don't really know what you're getting into, and it makes it hard to just launch.
Good afternoon. I think the most interesting piece of this is really, the RCT is like one piece, but what I find most interesting is what happens before the RCT begins. Like, what are the assumptions that are built into the logic model? But also, what do we do with that information? I mean, we can run, you know, as many, like you mentioned, thousands and thousands of RCTs, right, and we gain, you know, certain information, but the real crux of this is like, what are we going to do with the knowledge that we have, and how does it inform decisions that we make at a policy level, or we make fiscally as we think about our city and our country? And I think that's where we've kind of missed the boat, and that we're testing, and we know things and we know what works, but yet we still don't invest a lot of times what we know works.
So Liz, if I could follow up then, having just launched an organization that you're saying is equally about doing and actually improving lives and learning, can you say a little more about how you're thinking about that, particularly with this point that as you learn, what you're going to do with it?
Yeah, so I think what Chicago Beyond is really trying to do is to first, like, really involve the people who we're looking at, right? I think so oftentimes those folks are kind of left to the side, and so as we're thinking about programs that we're investing in, or organizations that we're investing in, really having folks in the community at the table helping us, like, all the way through in terms of what are we trying to not only learn to better organizations and to better ultimately communities, but how are we kind of carrying them along through the way, not just leaving them once we get the RCT data that says what works, but really trying to spur smarter philanthropic and public investments in what we know, what works. And so it's really about the learning, i.e. like the RCT or whatever the rigorous evaluation we'll use for a particular investment, but then what are we also doing at the end of that phase? How are we actually spurring smarter investments in our kids?
So just to come back down the line, Greg, if you could say, I want to dig in a minute to the challenges of doing really rigorous evaluation from the perspective of a program provider, and what are the real things that you've had to navigate through. But before you do that, could you say something about something that's worked and been surprising and actually helped bottom line improve its bottom line?
In terms of the actual program model or the RCT?
In terms of actually engaging so deeply in an evaluation.
So I think what we've learned is we've really gotten clear about our process. In years past, before we had done the evaluation, we were sort of a first come, first serve organization, really not paying attention to the process by which students were coming in. Until when we decided to say, okay, how do we really understand who we're serving and who we're not serving? And then we put a much better structure and process to who actually enters the program. And that has changed our ability, because we've changed our recruiting process, it's changed our ability to control who actually gets our intervention, which is giving us the chance now to really look at who's succeeding most closely and then focus on who we should provide it for down the road. So it's really enabled us to get that information we need to change the process.
And then the inverse of that, the sort of flip side, I think there's anxiety, and I want to ask you a question, a relevant, related question, but the flip side is that, and this is really for all of you, the risk or the fear that the tail will wag the dog, and that the RCT or the randomization or the rigor will somehow upend the magic of the program and what you're doing. Has that been a challenge?
It hasn't, probably because we are an organization that is so built with a culture of sticking with what we believe works. And we have a strong personality behind us where we have set our process up. And it's a very process-driven approach to begin with. And so we have not, when we entered this process of doing the RCT, we wanted to do it with the program that we're doing, not change something to sort of serve the need. But yet, yes, we altered how students enter, but after that, we are delivering exactly what we were 3, 4, 5 years ago, 8 years ago, with obvious improvements on sort of the learnings over time. But we have made an intention not to change what we're doing against what our goals were.
Sean, could you talk about that? Sort of the risk of the evaluation wagging the dog?
Well, I think bottom line is an excellent example. This is an evaluation that we are funding, and it is a case where, as I understand it, and tell me if I've got it wrong, because you're the one who's deeply involved, but this was a case where the program already was oversubscribed, as a lot of good programs are. Not enough slots to fill. You were allocating slots on a first-come, first-served basis. It was not changing the structure of the program so much, but instead of allocating on a first-come, first-served basis, the limited slots, you used a randomized lottery. So, as I understood it, they weren't changing the substance of the program, they were just changing the mechanism by which people were coming into the program, a mechanism that was still fair, but also allowed for scientifically valid evaluation. So you have 2,500 students, roughly, is that right, who've been randomly assigned to treatment or control groups. You have very promising initial results, as you showed us earlier today, and hopefully those will continue. But I think that's a great example where at relatively low cost, relatively little burden to the program, they've been able to build incredible evidence about an important program.
I just want to add into that, because I think that could be potentially the one fear, but I think what I've also seen is that there is we're not trying to go into historical aspects of this, but there's an ultimate, sometimes like an inherent mistrust that exists between like the research entity and communities, and that's a big part of it. But then there's also the ethical dilemma that organizations face when we think of RCTs, of having to turn children away who you know need services. And so I think that sometimes can pull people out of the RCT. So it's not just, I think it's a myriad of reasons why people oftentimes pull back.
Just to underscore that, I think that I was in a meeting with community leaders on the south side of Chicago talking about some of the urban labs work recently, and somebody used the term the gentrification of evidence. And I was like, oh, I've never heard that sort of framed that way. And that will a little organization that literally is serving its immediate neighborhood and based on a word of mouth basis, would they be able to engage in such a rigorous approach to building evidence, even with philanthropists like some of the people in this room saying, do it, we'll support it? Could they do it? And so there's a sort of question here to grapple with as well about how we think about this level of rigor, particularly with regard to small organizations, community-based organizations that are not interested in the randomization bottom line could do because of its scale.
But even, I would push on and say, we're gonna push here, the whole panel's about, we're gonna push. I think that even larger organizations struggle with this. They are, I think, more and more, as you know, with budgets shrinking and with people being driven to really prove like what works, people will subscribe to it for obvious reasons, but often have their own internal struggles too. So it's not just the tiny organizations, I think, that really grapple with this.
I would say we talked about what are the challenges of doing something like this. This was one of the key challenges as an organization. So we did this trial in a couple of our sites in New York and Boston. We coordinated with the chief evaluator here, Ben Castleman, and it basically went around and did a roadshow for our staff. Part of the challenge of convincing our staff that this was a good idea was was helping them understand why we were doing it, why this investment, why we might be turning students away who would otherwise in previous years be accepted if they just applied at the right time. And that was a key challenge to making sure the entire organization was on board, understanding why, because they were our program staff was delivering the feedback to the parents and the students who, when they didn't get randomly selected in the lottery, we did an outreach and say, you know, unfortunately, you're not able to take advantage of the services we're offering, but here are the other options that you have available to you in the community. And that was a different process that we went through before. And what's even sort of more painful sometimes is we actually have two potential entry points in the bottom line program. One is at the end of their junior year of high school, but we have a secondary program which is not right now being evaluated. It's our Success Direct program where students come to us once they've picked a college. And it's very important now that we can't, for the, you know, the sanctity of the program, we can't now take those students into that program either. And so we have this sort of restriction list because we're evaluating over a 7 period of time, and that is even more difficult because it comes back again that a student a second time would apply and not get in. And we've had some challenges with our staff and sort of really talking them through, and rightfully so. They should be concerned that we're sort of not able to offer every student that opportunity. The one thing that we have is that we couldn't possibly serve everyone anyway, and so this is one way that we can argue it is the most fair opportunity to decide who is able to be getting it. So that's the most fair.
Yeah, and if I could add to that, there are a lot of cases where that is true. You can't serve, most programs can't serve everybody. So a randomized lottery for charter schools, for whatever, different programs, is a fair way to allocate limited resources. We have a study that we're just funding now in Baltimore in very low-income schools, where a company that, a nonprofit is coming into Baltimore. They are providing glasses, vision, eyeglasses to low-income students, screening everybody in the school, providing glasses so that people can see. And there's some evidence from some prior studies, very good studies, but in other countries, showing that that can make a difference in learning. So they're coming in and they're providing this to every school in Baltimore, all 132 elementary and middle schools, but they can't do it all at once. They don't have the capacity to do it all in one school year. So we are working with researchers at Johns Hopkins funding a randomized trial where a third of the schools are going to get it this coming year, a third of the school, and they're going to be randomly assigned between the different years. A third are going to get it the next year, and a third are going to get it in 2018. So it's a random assignment study, a very big one, but it's just sort of building random assignment into the way this program is being rolled out without denying anybody services that they would not otherwise get.
So I'm going to go, for those of you who were downstairs when Sir Ken Robinson was talking, I thought he surfaced some other existential questions for us as we think about rigorous evaluation relative to young people. And given the state of instrumentation, for lack of a better term, or data, and ways of measuring progress, I've spent most of my career measuring educational progress or being involved in educational activities and looking at test scores and graduation rates. And yet, we know that there's more to it. And if my colleagues from the Urban Education Institute were here, they would remind me that the thing that the test score really predicts most effectively is how well you'll do on your next test. But it won't predict how well you'll do in college, nearly as well as grades, for example, which suggests something about effort. So the deeper question, I think, for me that came out of the Robinson discussion was, okay, we're all here on the 4th floor and we've bought into rigorous evaluation. We want data. We know that we need to know what works and put more money into it, both philanthropic and public. But then what should we be looking at? How do we know whether things are working if we're right to be incredulous about the things that we often use?
To try to answer that one, I agree with you. That sort of looking at test scores, especially test scores over 1 year, over 2 years, etc., is that a good predictor of life success? Who's going to go on to college? Who's going to succeed in college? What their workforce earnings? Nobody knows. That's why our view is that it is very important in the studies that we fund, not just to measure the short-term measures, the one-year measure and so on, but to measure over the longer period. So let me give you an example of something that has been shown convincingly to work over the long run in education. New York City, in the early 2000s, in the Bloomberg administration, citywide started shutting down its large, low-performing high schools and replaced them with much smaller high schools that were competitively selected. They were called small schools of choice. In addition, each student within the city had a choice of which of these schools, large or small, whatever, to attend. The small schools could not serve everybody at once, so they used a randomized lottery. New York City used a randomized lottery to determine who got the small schools, who stayed in the large schools initially. MDRC did a very large randomized trial using that randomized lottery with 20,000 students randomized. They found initial effects, but the key question is what happens over the long term. So they recently published their 5-year results, and they found that this initiative citywide produced a 6 to 8% percentage point increase in the number of students graduating high school and enrolling in college the next year. So it wasn't just the interim measure, the test score. This was actual graduation, enrollment. They also scored higher on the Regents exam in New York. A substantially higher number scored proficiently. So that's kind of, I think, I'd suggest the final goal. You really want to know whether it has effects not just on immediate educational outcomes, but on the outcomes, life outcomes that people are really concerned about. In the bottom line study, to your credit, you're measuring not just matriculation in high school, not just in college, not just persistence, but actual college completion. So long-term on important life outcomes is very important.
So I would say agreed. But I would also say I think that again, I want to pull us back to then what happens. Like I feel like we have to act, and we have to. It's how we funnel dollars, and it's how policies are ultimately made. Because we can know again what works, but if we're not actually pushing that forward in some real way to serve kids, what does all that really matter? We just have a nice set of data that validates, one particular program, but that program then is with these small number of kids. I think it's really about thinking about scale as well. Like how do we scale and really think about like what works and getting it out to more folks?
Yeah, I think that I've never really thought about Bottom Line as a policy-driven organization. This is the first time we're jumping into a space. We've just been delivering our program in the markets that we are. We're focused on internal data and approach. We don't get caught up on what's on the outside. We try to figure out what are we doing that's doing well. This is an opportunity for us to comment on policy and say, look, we have a very simple idea here that says high-quality relationship-based advising over a long period of time has a dramatic impact on whether a student finishes college. And if we can essentially prove that, then hopefully, it's not just Bottom Line's program that's going to go to scale, but it's the colleges where we're delivering the model that will say, okay, so you have a 1-to-100 ratio of someone who really cares about that student's success on the ground every day. Well, what if we deliver something like that through our university or through another community agency? And I think that's where we can comment on the success rate of not just our program, but of the model itself.
So can I just add, I would agree entirely with Liz's point. I think it's a huge problem. What if you do build the evidence, you find something that works, if you're lucky enough, what happens then? The small schools of choice in New York City, I think, is a great example of that, because when the Bloomberg administration ended, the new mayor came in, Mayor de Blasio. He had run against the small schools of choice policy and ended the expansion of that program. And his school chancellor, when asked by a New York Times reporter about that study, she said, well, that's one view, but there are many views. So unfortunately, the evidence was not, this really unique evidence. People, I think, don't understand how rare, credible evidence of meaningful impacts was not used. There are other examples, however. There was a program that at the Department of Education that was established in 2009 at the beginning of the Obama administration called the Investing in Innovation Fund, which was designed basically to take evidence-based programs and scale them up. So KIPP Charter Schools was an example of that, had good evidence, was given a large grant to scale up. To the Department of Education's credit, they required a replication trial a randomized trial to see whether KIPP still worked when it was implemented on a large scale, and sure enough, the effect was reproduced. But that kind of program, government program where evidence plays a meaningful role in determining who gets funding, is by far the exception. And in many cases, you do have the problem that Liz described, where programs are developed, have great evidence, we ought to expand them, but they unfortunately don't get expanded because there's no incentive to.
And this is something I think Tim and I have talked about before, and I think is really interesting, and how I'm thinking about Chicago Beyond is, how do you really create a movement, right? How do you move an entire city or an entire community, right? It's totally not impossible. I think that how you do that is you bring the community along from the beginning. So oftentimes RCTs or different things are happening sort of removed, if you will, from the community. But if the community is there from the beginning, if they're part of the process, if they're there as it goes on, if they see what works, understand what works, and if they're in that, then you then have like the seeds, if you will, to begin to create a movement of people really pushing for the policy or pushing for funding. I mean, we've all seen, I'm sure we can think of dozens of examples throughout not only our country's history, but even here in our city, where groups of people have really gotten together and pushed for particular things, and we've seen action. And I think that's where it becomes super interesting when we think about the idea of a movement.
Just to punctuate this beginning of the conversation about how do we actually know what works. I think what we've been trying to think about at Labs is not just looking at an educational intervention in terms of educational outcomes, but building the architecture, the machinery, as it were, to be able to look and say, okay, bottom line, you're doing this. And you do have great outcomes in terms of persistence and completion of in college. And we know that's a great proxy for earnings and other things. But could we actually build a system that would look at earnings and look at health outcomes, look at crime outcomes, and look at the educational outcomes in a much more systematic way at civic scale, so for a city or for a community? And I think that's where we need to get in terms of building a much more robust picture of whatever kind of social sector entity we're trying to get airborne, linked with Liz's really critical point about who's at the table and when. And so I want to switch gears again and given the audience and some of the panelists, and ask a question of the panel about how, as funders, you should think about this. I know that many of the people in this room are involved in some way with educational organizations, whether investing, or sitting on boards, or otherwise. The evaluation thing comes up how often? Like, how do we know questions come up every meeting, right? So how should we be thinking about this as we think forward to the next decade with Robinson's important, this is going to take 40 years caveat?
Well, I unfortunately am going to have to agree with you.
I thought you were going to say I have to leave.
I agree with you. It is important to measure, and one thing foundations can do, which is a counterweight to what a lot of researchers, the incentive is to do the study, find the short-term effect, unfurl the mission accomplished banner, and move on to the next study, and never find out whether the effect was, whether you really improved people's lives or not. So as funders, I think one thing we can do is to make sure that if there is a short-term effect, to extend the study to see whether you get the long-term effect. And also to link the data. If you have educational outcomes, can you also measure workforce outcomes? Just to give you one example, there was a study that MDRC did of career academies, which are small communities within low-income high schools that have a career theme and links to local employers. They did this back in the early 1990s. They measured the educational outcomes and didn't find much. Okay, there was not an effect on school completion, there was not an effect on college enrollment, but there was an effect, an early effect on the links, the activity with local employers. So they continued, to their credit and to their funders' credit, they continued the follow-up of these students for 11 years after random assignment, 8 years after they graduated high school, and they found a really large sustained effect on workplace earnings. These are for low-income students, about a $2,500 per person increase in annual earnings compared to the control group. So I just don't think it can be underscored enough. The ultimate test is whether something produces an outcome where your grandmother would understand why this is important, and not just, you know, a proximal outcome that's of interest to a researcher.
So I would say a couple of things. One, I would say that we have to stop fixating on one piece of the puzzle, right? So the RCT is obviously important, but it's also thinking about the second piece of it is, like, again, like, where's the community in all of this, right? Ultimately, these are the folks that have to pick it up and run with it. These are the folks that have to live with it. And so how are we bringing the community along on the entire journey? How are we getting ideas? How are we really surfacing the knowledge that's within the community? Oftentimes when we work with communities, if any of you have, and I'm sure some of you have, like, sometimes they come out and it sounds like word soup, you know, you're talking and it doesn't quite all the way make sense, and they're, you know, emotional or whatever, but there's value and there's knowledge in what folks have to say about their own community, and so I think sometimes they often get left out. So again, inclusive of the community and thinking about how that follow through and to the end point, right? It just doesn't end with the RCT, but it's really strategically thinking, especially in the funding community, about how are we trying to spur smarter public and philanthropic investments more strategically here in our city as a whole. And I think oftentimes the ball kind of gets dropped there. I'm speaking as a practitioner, as someone who's worked in the community my entire life, right? Kind of gets dropped at that point. You have a great program, there's an RCT that happens, there's resources, supports, everyone's there. And once you get the knowledge, or when someone gets the knowledge, it's kind of dropped and you never hear from folks again, right? So it's like really thinking about carrying the ball all the way through.
I guess I would say from the practitioner side, the funder, for what we're looking for from the funder approach is be willing to take a risk on putting some money into the evaluation part of whatever we're asking to do. There are probably too few funders out there that would be willing to invest in that part of it. Like I know that the groups on this stage, obviously, and I think Todd from the Michael and Susan Dell Foundation, another one that sort of it was partly his initiative that said, geez, I really want to invest in your program. If we threw in some extra capital here, would you be willing to do part of this as to evaluate its progress? And that was what got us starting to think about it. And so it's being willing to engage with the grantee to say, how would you evaluate this in a more rigorous way? Not just what are you doing internally to tell me what happened, but how do you go external and get somebody involved, because it adds some complexity and some dollars.
So I'm going to turn it to you in a minute, but before I do, I'm going to probe this scale question a bit further, because people have said scale. I know we want scale. I think I have kind of an architecture question. It strikes me that Greg said at the outset, we haven't really stepped into the policy world. And I said at the outset, none of the people running for president seem to think that the public want to hear the talk about data or evidence. They've got other lenses. That the academy, higher education, isn't very good at this, isn't typically organized to do that, to work with policymakers, to get them to not necessarily to say to bottom line, we want bottom lines in every city in the country, but to say we want to take what bottom line has done so well and scale it with other nonprofit organizations across Chicago. So it just seems like there's a shortage, like the yes scale, but there's this gap in terms of strategy for getting there. And I almost see a human capital gap. I mean, if higher ed's not doing it very well, and people can argue with me, and practitioners aren't doing it just by virtue of being in practice every day, then who and how? And clearly some of the people up here do it, but are we really going to get the message across, and if so, how, to the people who are controlling vast sums of public money that are being invested, particularly in education?
So at the end of the Bush administration and at the start of the Obama administration, there were some initiatives enacted into law in social spending, in education, and in other areas, where that departed from the usual approach to social spending and education. Usual approach in Title I and other education programs is that Congress tells the federal agencies to allocate large streams of money to state and local organizations, sometimes to a formula, sometimes to a competition, but where evidence plays very little role. Evidence about what works plays very little role in what gets funded at the state and local level. So these new programs, they're called the tiered evidence programs that were enacted into law. In my former organization, the Coalition for Evidence-Based Policy played a central role in advancing those, developing and advancing those. Were different. The largest grants, one of them was the Investing in Innovation Fund I mentioned. The largest grants in those programs, the way the law, it wasn't policymakers saying, oh, let's pick Success for All or Teach for America. They weren't making those decisions. What they did say was, we're going to set up a program, a grant-making program within the Department of Education and in other departments, in which the rules are that evidence plays a defining role in what gets funded. So the largest grants, scale-up grants, went to programs like KIP, and Teach for America had moderate evidence, but anyway, that was scaled up as well. Reading Recovery was scaled up. Programs that had good evidence. And that, I think, that's what I would suggest is one answer to your question. You need to change the incentives, fundamentally change the incentives in the way that government dollars are allocated, so that there is, so that they're focused on things that work, and so that there's also a requirement for rigorous evaluation. Because spending as usual, without reference to evidence, doesn't get you very far.
Any other thoughts?
The only thing I would add is that I think there's a perception out there that rigorous evaluation is enormously expensive, or tremendously expensive, as you would say. And it doesn't have to be, but that's what scares a lot of people away from actually putting evaluation into practice to get to the policy that you're after. And so I think there has to be a demystifying of what it actually costs, and could you do it within the context of your program and not alter things, because that it is a prohibitive thing for people to move away from.
So tell them, what is the cost of this study?
So roughly, we'll spend between 160 to 180,000 over 7 years, as it's currently defined. We had quotes when we were doing the conversation for $750,000, depending on who you talk to. So I think if you talk to the right evaluator and you find someone who's terrific at, whether it's a university or an approach that they can sort of look very quickly at what you're actually trying to evaluate, you can do it at a much lower cost than what you find out there. So it is something to pay attention to when you're trying to do it.
And I would just add, particularly for people who are in the philanthropic business here, if you're going to make an investment, that the value of sitting down and thinking about the design of the evaluation early, before you do the investment, means that in technical terms you can do a natural experiment. So you don't actually, it doesn't cost anything really, or it just costs the time of the researchers and the data analysis to actually get really, really good evidence. But it really demands, and this is something Liz and Chicago Beyond are doing really carefully, it really demands being side by side with the sort of program providers and the evaluation folks and the philanthropy, and working it all out beforehand. Otherwise, the costs can get prohibitive for sure, or you can fail to get evidence at all. So with that, let me turn it over to you. I think there's microphones because this is all being broadcast to Dubai.
Hi. So, we're in this room having this conversation, many of us evaluators or philanthropic people who are funding this work. And I guess, and sort of as we're having this conversation out there in the world and even in this room, people are creating nonprofits and creating programs. And so I guess I'm wondering from the panel, what you think the kind of basic building blocks of a program or an organization would be that would set you up to be able to evaluate yourselves in this rigorous way? Because I've worked in a lot of different nonprofits, and sometimes it's really challenging to pull this off if there's like certain things that aren't there. So I'm just wondering what everyone's opinions are about what those elements would be.
So that's a great question. I think it touches on Liz's comment about what to do other than the RCT. Most folks who approach us to do a rigorous evaluation, many of them are not ready for an evaluation. And in general, one of the threshold questions that we look for is the program well implemented? Are people showing up for the program? Are the students staying in the program? Are the teachers adherent to the protocol? That's sort of the initial question. Do you have sort of a well-developed, mature program, manualized program? Because if you don't have that, then and you go to an RCT, you're not going to find any impacts because your program isn't well functioning. So that's sort of a threshold question. We also look for non-randomized evidence, prior evidence, correlational evidence, whatever, to suggest a meaningful impact is possible. The reason we do that as a funder is because most things, unfortunately, don't produce the hoped for impact when they're evaluated. So we want to maximize our chances of finding something that works by looking to the prior evidence. So prior evidence and evidence of successful implementation are the two things that we look for.
I would say that we've sort of followed that model. Back in 2008, we did a simple, matched comparison analysis, which showed some positive trending outcomes, and we did a regression and discontinuity analysis a few years later. We talked with the evaluators, so we were dabbling in this to try and figure out what is the impact we thought we were having. So it led naturally to, okay, what is the more rigorous test we can do? When I was just talking to somebody back in Boston recently about, he was trying to figure out, he was launching a new organization, and I said to him, and this is not something I would have said a few years ago, I said, you should call Josh Goodman over at the Kennedy School, because before you launch this, talk to him about how you can put things in place to start the pathway of putting an evaluation in place. And that wasn't something I was savvy to a few years ago, but I think him doing that now when he launches can get an opportunity for him to start to understand what the impact is he's having at the very early stage. So that, I think, is where I would want to be from a new practitioner.
I would just add that there's a lot of tension here in the sense that a lot of nonprofits are living hand to mouth, and that their brand is almost all they have. And so for some nonprofits, the idea of sort of opening yourself up to a really rigorous analysis has sort of existential risk in it. And I don't think we should overlook that. And so my answer to that question would also be, where is the leadership and where's the board? Do they really actually are they that kind of an organization that really wants to know and look hard with the idea that they're going to actually get better over time? Because without that, I think and I don't mean to sound like I'm impugning people who are more concerned about just keeping going and maintaining their reputation, but without that kind of buy-in at the leadership level, including the board, I would be hesitant to push for it. Other questions?
So I'm sort of thinking this question through. So you're saying, there are a few programs out there that actually have measurable impact. And you also mentioned this whole existential, conundrum that we have. Is the suggestion that they're not having any beneficial impact at all? Can we know that? Can they be, supporting the community or the students in other ways? And is the thinking that they should close their doors, and other nonprofits that do have it, I'm not sure where we go with the information, I guess is what I'm saying. So I'm hoping maybe the panel can just speak to that.
I'm just the moderator, so I don't.
One possibility for an organization is to look around that's delivering services, to look around, maybe they There are some evidence-based interventions, some that are backed by promising evidence, some by strong evidence, which could be adopted or adapted. So that's one possibility. Another possibility is to, on the existential question, is not to put everyone's eggs in one basket. Because there's sometimes a program has, different models or different variations. Sometimes they serve, kids who are about to go to college, trying to get them into college. Sometimes they serve independent adults who want to go back to college and so on. They can test different versions of, so you could test different variations on the program, especially if you can do it in a low-cost way measuring the outcomes with readily available data, as Bottom Line is doing. But to allow you sort of to diversify your risk, to test a number of different approaches. Those are two thoughts on how to address that. But ultimately, I think it would be great, getting to your question, we're all in this business presumably to have a meaningful impact. And if we're not, it's important to know that and to migrate toward delivering other services that are having an impact.
But to realize also, I think that there are great programs out there that have not, for whatever reason, had the opportunity to have a rigorous evaluation. So it's not that the end all, again, the end all be all is like, we can only invest in things, we can only, give dollars to those who have the evaluation. For whatever reason, they might not have this. There is good work happening in our communities. And that's really what Chicago Beyond is built on. It's the idea and the notion that there are amazing folks within the Chicago area, within Chicago, who are doing great work. So how do we figure out how to support the heck out of them? How do we support them understanding like what works best with their program and how to think about scale, and then not leaving them again at that point, that end point, but then thinking about how to spur smarter public and philanthropic investment.
This is a small thing, but I think also, no question, there are places without evidence that are doing, we can conject are doing great things, and we should learn from them, otherwise we're going to go down by way of Rome. But one of the nuanced answers, I think, to your question is to figure out what you're going to do with that information. If it's actually management information, if it's actually going to the board and the leadership of the organization, and it's going to help them improve and not be splashed across the newspaper, we can be assured they'll splash it across the newspaper if it's good news, right? We definitely know that. But I think at the front end, there's if we really are trying to build an ethos and a culture where evidence is driving improvements in social sector programs, particularly for young people, that we should just be sensitive about kind of, and I know sitting in the academy, academics and professors like to be able to publish their thing. But therein is existential risk for that nonprofit. And so could you build ways where they're not necessarily publishing that thing right away, or there's ways of communicating that wouldn't necessarily create chaos. I've just got a sign that said 0 minutes. So this feels like a good time to stop. Thank you very much, everyone. Tell everybody we killed it.